Now I have to present, and this isn't going to be good, but I'm going to ask Cassian if he'd throw my slides up, please, because I get to share a new method of shared decision making, and this is something that Kidney Cancer Canada was approached to work on. And it's going to be a tool with medical oncologists, and the tool is their tool. And this is going to be distributed across Canada, and we are going to have this live on our website as well. And we'd like to inform as many patients that have been newly diagnosed with metastatic disease who are facing their first lines of therapy. And it is an app, and it's called myRCC. And the app belongs to, the medical professionals, but in partnership with patients. So this is the steering committee that was created to develop this tool and make it as patient-friendly and patient-centric as possible, so that information was provided for them and tools were provided for them so they could help make the decisions of what was important for them to move to their first line of therapy. And I have a series of videos that will be shared with patients and will be shared with medical professionals, and an example of the sheet that the patients will be, it's very simple to fill out, that the patients will be asked to complete and either send to their oncologist before their first appointment, or they'll see their oncologist and immediately have a following appointment so that they can talk over which line of therapy, and there are currently 4 lines of first line therapy, so that they can be considered and catered to what they want from their systemic therapy. What's important to their life? And actually, we just heard 2 patient stories, and, it's very clear, that they both have taken risks, making decisions in their systemic therapy, or their journey, as we're calling it today. And but making it their own. And this is hopefully going to help other patients that are facing oncology to make it their own. So Cassian, if you don't mind, would you please run the first video? And this is what the healthcare professionals are going to see, and I want you to have an experience of what's coming up. Hello and welcome. I'm Christine Collins, Executive Director of Kidney Cancer Canada. And today I'm joined by Dr. Christian Kohlmannsberger, a leading medical oncologist from BC Cancer. Thank you for being here, Dr. Kohlmannsberger. And could you share a little bit about yourself?
Thank you, Christine, and hello. My name is Christian Kohlmannsberger. I'm a medical oncologist at BC Cancer in Vancouver, BC, and I have been treating kidney cancer patients for the last 25 years. And have been very involved in the development of the novel kidney cancer treatments in Canada.
Mm-hmm. Thank you very much. We're very excited to be here and introduce a new tool designed to support both patients and clinicians in making informed decisions about kidney cancer treatment in first line. It's called myRCC. It's an app built around shared decision making in first line treatment to help personalize care. The app was developed by a steering group of oncologists, including Dr. Kohlmannsberger, and I had the privilege of representing the patient voice throughout its development. Our goal was to make sure that the app truly reflects the needs and concerns of patients. Kidney Cancer Canada is a national community of patients, caregivers, and healthcare professionals. We're here to provide support, education, and advocacy for everyone affected by kidney cancer. Dr. Kohlmannsberger, Could you please share how you see the myRCC app being used in clinical practice and how it might benefit patients?
Yeah, the myRCC app was developed to help guide patients and physicians through the ever more complex kidney cancer treatment landscape. Over the last 10 years, we've introduced a number of novel therapies and therapy combinations, and it has been increasingly difficult to really make treatment decisions for an individual patient. So in order to help to make the best individualized treatment decision, myRCC was developed. And it consists of two components. There is a patient questionnaire, which can be given to the patient at various time points, depending on what the situation is. But the objective of the patient questionnaire is for the patient to formulate what treatment goals the patient has and what the important parts of the treatment for the patient are. And that can then be matched with the physician side of the tool that, based on the patient objectives for the treatment, can then suggest the best treatment options, including the pros and cons. And that can form the basis for a very individualized discussion between treating physician and patient to get the best possible treatment for an individual patient.
At Kidney Cancer Canada, we've learned through our patient community that kidney cancer is truly a unique disease. And what one treatment might work incredibly well for one patient may cause serious side effects or have little effect on the cancer for another. So we've learned that's why individualized care is so essential. And I know you've touched on it, but could you please speak to the importance of individualized care in kidney cancer?
Yes. Every patient is unique and every patient is different. Generally speaking, we are very lucky and fortunate that we have made incredible progress in the treatment of kidney cancer over the last 2 decades. And the outcomes for our kidney cancer patient has dramatically improved. But there are larger and smaller differences in the different treatment options. And depending on the patient's conditions, preference, extent of the disease, and other factors, it can be important to individualize treatment and choose one or the other regimen.
Thank you, Dr. Kollmannsberger, for your insights and for your role in developing this important resource. And to everyone watching, if you or a loved one is facing kidney cancer, we encourage you to speak to your healthcare team and ask about the myRCC app. I hope that video was informative. This is what is going to be presented to the healthcare professionals. It's not necessarily meant for patients. It's to introduce to healthcare professionals what we intend to be shared decision making. And let's be honest, it's a new concept for a lot of medical professionals, and it's growing, it's getting better, and we just kind of want to let them know how important it is to our patient community to be involved in their choices that they're going to make going forward about their own care. Now, I will qualify it, and you'll see it in another video. In discussion in some of the panels that we had with multiple healthcare professionals, it was brought forward, and it's perfectly fine. There are a lot of patients that come to see oncologists that do not want to participate in their care choices. They just want the doctor to, you tell me what I should be on, we're going to go through it, and I'm going to get better. And that's great. If you don't want to do the research or be involved in choices, there's nothing wrong with that. That's perfectly acceptable. It's your decision. But there are also a lot of patients that like to do the research, that like to have the knowledge and information. And in conjunction with their healthcare professional or their oncologist, they make the choices about what care they're going to receive, what the outcomes might be, what they might face during that time. So this is to help those patients. So as you can see, this is going to live on the Kidney Cancer Canada website. It will also be available through your healthcare professionals. Um, if they don't offer the myRCC patient intake form, then you can certainly ask for the myRCC patient intake form. And it lets you be involved in your care, identifies your treatment goals. As you can see by some of the questions, it might be hard to see, but for example, tumor stability or reduction. Is that a key element of what you'd like to see? Complete response, quality of life. Sometimes when you're on a more difficult treatment, your quality of life may be quite compromised. And is that something that you're willing to, put up with in order to maybe have a different kind of systemic treatment? So this kind of targets what gives you time, not sitting across from the doctor and rushing through it. You have time to sit and think about it yourself. If you are inclined to talk with your family or other healthcare professionals about your choices, then it gives you a little time to do that and just to process, because we've talked over and over again today how we're sitting across that desk from the doctor or across from the table, and they say, they give you your diagnosis, or they say, this is what you're going to do next, and this is after that, and then you walk away out of that office and you have no idea really what's been said. So this really gives you time to process, time to think, time to research, and make decisions that are best for you and your situation going forward. Cassian, would you mind if we showed just a little bit, I'm trying to remember the videos, maybe number 3, if that's possible, please. And I hope patients will take advantage of this, at least investigate it to see if it's something that's right for them. Hello and welcome. I'm Christine Collins, Executive Director of Kidney Cancer Canada, and joining me today is Dr. Christian Kohlmannsberger, a leading medical oncologist at BC Cancer Centre. In this segment, we'd like to highlight how the myRCC app can support patients in understanding their treatment options. We have touched on it a little bit, but this app is designed to facilitate meaningful conversations between patients and their healthcare teams, helping them to make informed decisions about their care. Before their first appointment, the patients received an intake form that we've already spoken about. Sometimes just shortly beforehand, depending on the facility, you can complete this in the waiting room if needed. Once filled out, this form is shared with their oncologist or healthcare provider to guide the discussion. We've talked about, Dr. Kohlmannsberger, how clinicians can use the information from the intake form to help guide the selection of the first-line therapy. Is there anything else you'd like to add that would offer more information to the patients and what the next steps are?
Patients will bring their intake form that they filled out and their questions along to the consultation. The physician can then input the treatment goals, the individual treatment goals into the app, and the app will provide a list of the best matching treatment options based on the goals the patients provided. The app also displays the clinical data, the toxicity data. The patient and physician can discuss that based on easily understandable graphics that are incorporated into the app. And at the end, the physician can print out the information, or the patient can be provided a QR code so that patients can go home and review the information at home again and bring back more discussion points if that is needed for the next discussion when a treatment decision has to be made. That is important because it is a lot of information to digest for patient in a short period of time. So it is always good to take the information home, discuss it with friends and family, and then bring questions back to the healthcare team as needed.
That's excellent. And you're right. There's so many factors that come into play when choosing that first line therapy. And I think this is really an introduction on the conversation of what the patient goals are. patients do have different expectations of their treatments. And so this is really the first possibility that I see as a tool opening up that conversation with their oncologist and healthcare team. So I find it very positive. Research shows, Dr. Coleman-Sperger, that patients who feel involved in their treatment decisions often manage better during their therapy. Of course, that doesn't mean they won't experience side effects or maybe face challenges, but feeling like a partner in their treatment can really make a difference. Do you find that?
Yes, it makes the world of a difference in treating patients. I try to educate my patients as much as they can so that they can actively participate. A educated and engaged patient is a motivated patient, and motivated patients can very intimately participate in their own treatment. And I don't think it is surprising that that helps not only outcomes, but also to better manage treatment.
I agree. And I think it really keeps them on, when they feel they're participating, it really keeps them on target and opens conversations to other management techniques in their therapy. So maybe you could just touch on how that the conversation would instill confidence in talking to their physician, because sometimes we find patients don't ask questions or don't want to have the conversation because they're afraid of being taken off therapy.
Yes, I think it is important, as I mentioned, to educate patients about how treatment is managed and conducted, because it is a constant and ever evolving landscape.
Yes.
And we know that we have to individualize our treatments to the individual patient. Not every patient is the same. Not every patient tolerates the treatment the same. Not every patient can stay on the same time. So we have to find an individual solution for each patient. And the more the patient participates in that process, the easier it is and the better the outcomes are, because we can work with a motivated patient that helps us to make the right decisions.
Thank you so much. That is really important information to share with our patient community. I think it makes all the difference. And I think that kind of gives you, I'm just going to end just in element of time. I think it gives you a flavor of how much thought and preparation went into this whole program. It was almost a year in the making, and a lot of medical professionals' input, a lot of input from patients, because there was conversations with patients and caregivers and ourselves. So I think this is going to be an effective tool and an important tool. I'd love to hear comments, like if you want to shoot an email to info@kidneycancercanada.ca and let me know what you think, because I'm sure that powers that be will be asking how it was received today and going forward. As mentioned, in the next few days, these sheets and this program will be on the Kidney Cancer Canada website, and it will go live to the healthcare professional community. So, as I said, if you don't see it available in your office, ask for it, because it should be available to you to make these important decisions going forward.